Welcome to Kiowa County Hospital District's PPE video. In this video, we're going to be talking about how to properly use PPE, which is really our armor in the fight against COVID-19. So as we think about what's going on with this pandemic, we have to understand that for the most part, the spread of COVID-19 is from droplets that come out of someone's mouth or nose when they're coughing or sneezing. They stay in the air for just moments before they fall onto surfaces. And then we touch those surfaces with our hands, and we're touching those surfaces with our hands, and then if you're like me, you touch your face all the time and you don't even think about it. You touch your nose, you touch your eyes, you do those things. And as you do that, and it's on your hands and you don't realize, you actually give that virus an opportunity to get inside your body and cause disease. So if we can keep in mind that our hands are super important as we go through this, it will help. We also need to keep in mind that this virus doesn't have wings. It can't fly. It can't crawl. So it cannot get to you if you are following all of the social distancing rules and staying in home when you don't need to go anywhere, limiting your personal travel to only emergency situations, going to the store, getting what you need, hopefully at least a week at a time, and then not going back to the store where there's people that could be touching surfaces that then you touch and touch your nose, mouth, or eyes. Keep in mind, even if you touch a surface that is contaminated, as long as you don't touch your face before you wash or use sanitizer on your hands, you're still going to be safe. Okay, so first thing we're going to talk about is hand sanitizer. So you can use soap and water. For the purposes of this video, we're going to focus on hand sanitizer. You don't need a ton, but you do need to do a full 30 seconds, and you need to get every surface of your hands in between your fingers and all around your thumbs. You need to keep going until that sanitizer is 100% dry for it to be effective. So once I've cleaned my hands, we're going to talk about first putting on gloves. So gloves provide an extra layer of protection for us as we are working in healthcare. So right now I can touch anywhere I want on these gloves because they're clean. They just came out of the box. So I'm going to slip these gloves on my hand. And because I wear a watch, I try to get my watch, if I can, underneath that glove. Because things like watches, bracelets, they can all harbor some of those viruses and bacteria as well. So now that I have my gloves on, and I go about doing whatever I'm doing, taking care of patients, cleaning, doing laundry, whatever it is I'm doing with these gloves on, I'm touching surfaces. I may be touching people, patients, but my hands underneath are protected. When I am finished using these gloves, I'm going to consider the outside of these gloves contaminated. So I don't want to touch my nose, my face, or anything like that with these gloves because they are considered contaminated. To take them off, I'm going to start by just grabbing the corner of this one, pulling it straight off like that, and then I make sure that I have it tightly in my other hand. Now this hand is still considered relatively clean. So I don't want to touch the outside of that glove with this hand. So I'm going to try not to do that by slipping my finger underneath. So I'm on the inside of the glove. And then I'm just going to let that drop into the trash. I would then need to sanitize my hands again or wash them with soap and water, just like we did before. Now, we are in an era of a time where we don't have enough PPE to use it as designed. Unfortunately, we have a worldwide shortage of our supplies. So as a result, we are trying our hardest to conserve those supplies by reusing some things that we would have thrown away before. So for example, we have surgical masks and N95 masks that we are reusing. Okay, so I'm gonna assume that my mask is contaminated because I've used it before. So I would do my hand hygiene like I just did with the sanitizer. I'm gonna get my gloves before I ever touch this mask because it's been used before and I know that it's considered contaminated. Okay, so now that my gloves, I have gloved hands on, I'm able to actually touch this mask. When I'm not using it, it should be in a brown paper bag, such as this one here, because this is going to allow it to air out, and it is recommended by the CDC to keep these masks we are reusing in brown paper, not in Ziploc bags. Okay, so now I'm going to don this mask by grabbing these two straps and as little as possible touching the outside of that mask. However, my hands are gloved at this point, and as long as I remember that I'm not going to touch my nose, mouth, or eyes, I should be okay. I just want to minimize touching the outside of that mask. I have to touch the mask up here in order to tighten it down and make as good of a seal as I can. Now, the purpose of this mask is not to protect me from patients or other people. The purpose of this mask is twofold. The first one is I don't know if I have COVID disease because people can be asymptomatic or have no symptoms whatsoever for several days before they actually start coughing or get a fever or become short of breath. So I want to make sure I'm not spreading something that I don't even know I have. The second purpose of this mask is to remind me not to touch my nose and mouth, because when I have this on, I'm not able to touch my nose and mouth. When I am finished using this mask and I need to take it off, I'm going to start by opening this bag. And now I'm going to take this mask off and trying again the best I can to not touch the outside. I'm going to slip that into the bag. And then I'm going to go back to taking my gloves off. Okay? So how I'm going to do that is I'm going to grab a corner, just like before, hold that tight. Then I don't want to touch the outside, I want to touch the inside. Drop that in the trash can. Okay, so each time I put the mask back on, I need to make sure I have those gloves on. And each time I take the mask off, I should have those gloves on, because if I take the mask off with my bare hands, then touch that mask on the outside, I can be contaminating my hands. So then I would reuse either hand sanitizer or go wash my hands with soap and water. If your hands are visibly soiled, if you can see that they're dirty, you need soap and water, and this is not adequate at all. All right, so now we're going to talk about when we are going to take care of a patient that we suspect might have COVID-19 or is actually diagnosed with COVID-19. And that would be anyone who comes in who we determine has a fever, which is 100.4 or higher, a cough, or shortness of breath. If they have shortness of breath, they definitely need to be seen as soon as possible. So if they've come in to our hospital, to the triage area, and we are gonna see them. I'm gonna start with, before I even go down to the triage area, putting on my N95. So I'm gonna put on gloves. And the reason we're putting the N95 on before we go down there is so that we can keep it in our brown paper bag and be ready before we even get on that elevator. So now I'm gonna take my N95 that I was fit tested for, and slide my hand here. And again, to put this on, I do have to touch the mask, but I've got gloves on, and I'm going to avoid touching my nose, mouth, or eyes. Okay, so then put it on here. I'm gonna grab the bottom strap. I want that to land down at the crown, or I'm sorry, at the nape of my neck, and this one at the crown. Now I'm gonna tighten around my nose. Okay, so now I have that on. Now I'm going down to the triage area. I get down there. I need to also put on eye protection. So there's a couple choices. We have goggles that can be cleaned. Our current process is following the CDC's guidance that we will take these goggles, and when we are done using them, we will take them to the dirty utility room, and there is a bin there to put them in. Central Supply has specific directions on how to clean these. We want to avoid using the purple wipes or the gold wipes on the inside of these, because that is a very strong disinfectant. It is really not meant for anything that is going to touch your skin. So the preferred thing to do is to use them once, put them in the dirty bin in the dirty utility room, and then they will be properly cleaned by Central Supply. So I'm going to don this eye protection. Okay, so in the triage area, because each time somebody comes, it's a new patient, we are prioritizing the use of our disposable gowns there. So all right, so now at this point, I would provide the care for the patient that they need, and when I am finished and they have left, I want to make sure that I do put one of those surgical masks on the patient themselves. Once the patient is gone and it's time to take all of this off, I would start first with the eye protection. And now I'm going to take the gown off. So it's disposable. I want to try to avoid touching any part of this gown on my clothes. Now I'm just touching the inside of the gown, and I want that to land in the trash can. Okay. The next thing that I'm going to do is I am going to take my mask off. So I'm going to try to just touch the straps. holding on to that. But again, that's why my gloves are on still, because I might accidentally touch the outside of that, okay? At any point that I feel like my hands have become contaminated, I can take some of the hand sanitizer or foam, and I can cleanse these gloves if I need to. Kind of the same exact way that I did it with my, before I put the gloves on. Okay, so now it's time to take my gloves off. Grab the corner, hold that, slip my finger underneath, drop them in the trash. Get the hand sanitizer, clean my hands again. I know this might seem monotonous, but it is worth the time to avoid getting yourself sick, your family, and our community. Now we're just going to briefly touch on the situation where we have a patient who is admitted or is in observation, and we are going to have that same patient in that room for more than an hour. And when that is the case, we are going to utilize gowns that we can rewash. So that poses a few additional steps. So I just cleaned my hands, and I'm going to don some gloves. Okay, so my hands are gloved. I'm going to go ahead and reuse my N95. By the way, 5 times is about the limit on this N95 mask. But anytime you're having trouble breathing through this mask, you are more than welcome to get another mask, or if it's visibly soiled, get another one. Again, this is for a patient who has either suspected COVID and we're waiting for test results or waiting to rule them out, or a known COVID disease. This isn't any patient. The other patients, we are perfectly fine with that surgical mask or even one of the handmade surgical masks. Okay, so here is my N95 again. So now that I have my N95 on, I'm going to put eye protection. We also have face shields. For the purpose of this, I'm not using a face shield because I'm trying to conserve those. Okay, so now here is my gown, which will actually be kept inside the room. I'm touching the inside because that is my clean. I'm going to try to get it as much as I can. This is a brand new gown, but I'm trying to get it on as much as I can without touching. Okay, so at any point while I'm in the room and my hands become soiled, I'm not going to take the gloves off because my hands are my best and worst assets. So I want to make sure that my hands are clean the whole time. So if I need to clean my hands, I'm going to actually do it with this hand sanitizer. Okay, so now I've taken care of the patient and I'm done. It's time to leave the room. Before I leave the room, I need to take this gown off and leave it in the room so that I can use it again. But I don't want to take this gown out into the hallway exposing other people. So I've untied it, being very careful not to touch my clothes. Now, what I want to do is take this off inside out, because the inside is the cleanest side. I haven't touched the bed or the patient with that. Then I would hang this up on the hooks that are provided inside the room to do so. When I'm going to use this again, now I will be able to start with the clean side of the inside and put it back on. So I'm hanging that up. We'll pretend that I'm doing that. And now I'm going to take my glasses off. All right. Now I still have my mask and my gloves. I am going to step out of the room at this point. Make sure the door is completely shut. And now I'm going to do first is my mask. So trying to touch the straps only as much as possible. I take the mask off and then put it in the paper bag. Now I'm going to take the gloves off. So corner, hold it in my hand, slip my finger underneath into the trash. And then I would clean my hands thoroughly. I want to remember that when I go home, despite this, I still could have contaminated my clothes. So if you're taking care of a patient with known or suspected COVID-19, you can bring your clothes to work, change before you go home. But at the very least, change immediately when you go home before you give those kiddos a hug and your husband a kiss. Thank you for watching. I'm always available for questions. If anyone has any, please don't hesitate to contact me. Thank you.